Late Night Health continues. I'm Mark Alyn. We're going to talk about something I guess is pretty sensitive, male incontinence, and also talk a little bit about erectile dysfunction. Our guest is Dr. Gary Leach. He's with Tower Urology in Los Angeles, in Beverly Hills, actually, near Cedars-Sinai, one of the most respected hospitals, I think, in the country. Dr. Leach, welcome to Late Night Health.
Thank you, Mark. It's very nice to be with you.
And, of course, give our regards to Dr. Danoff.
I will.
I think we called him Dr. Sex. It was something like that. We gave him a nickname because he's...
Yeah, we had one on the air and one off the air. Yeah.
Yes, right, exactly. The on the air is the way. Dr. Sexy, something like that. So you can talk to him about that. Male incontinence, is this something that's common in, say, men over 40?
It is common. It's felt like up to 18% of men have problems with bladder control as time goes on. What
causes it? And let's talk about this in two stages, if we can. With, if somebody has, prostate cancer and they have their prostate removed, that'll be step 2. What about the average Joe who doesn't have prostate cancer?
So the most common thing we see in men, Mark, that do not have prostate cancer is that they have bladder control problems that are related to blockage from their prostate. So this is benign growth of the prostate. It's not a cancer. But many men, as they get older, their prostate starts to grow, and it tends to pinch off the channel where the urine passes through the middle of the prostate. And the response of the bladder to that blockage is that men tell me, when I feel the urge to go, I better get there right now. Otherwise, I may have an accident, wet my pants, wet my underwear. Even to the point where some men have to carry a bottle in their car. So if they get stuck on the freeway and they have that urge and they can't get off, they'll pee in the bottle rather than having an accident when they're sitting on the freeway stuck in their car.
Growing old sucks, Doctor. I mean, is that just a normal thing?
Well, it's not normal, but about 30% of men that have significant blockage from the prostate have this what we call urgency, frequency, and urge incontinence, meaning when they feel the urge to go, they better get there right now, otherwise they're going to have an accident. And that's, again, because of the prostate causing blockage to the flow of the urine.
Are there any treatments to stop that growth of the prostate?
Not necessarily to stop the growth, Mark, but there are medications that can be used to open the prostate that are quite effective. And there are some medications that can be used to shrink the prostate. But the medicines to shrink the prostate really need to be taken for 3 to 6 months before the person notices any benefit.
That long?
Yes.
And what percentage of men, again, over 40, have enlarged prostate without benign growth?
I would say eventually maybe 50%.
Oh, my.
It really, prostate starts to grow at age 40, but most men begin having symptoms, weak stream, getting up at night, feeling like they're not emptying their bladder. When they're in their 60s, sometimes late 50s, but most men are in that age range when they really start to have issues.
And that's because it's been growing for the last 20 years.
Exactly.
Right.
Exactly. A lot of that growth rate is determined just by genetics. I saw a man today. He's in the late 60s, and his prostate's the size of a cantaloupe. It should be more like the size of a peach, and all that is genetically determined.
Whoa!
Yeah.
I mean, where would it be? Where would he store that cantaloupe?
Well, it's inside the pelvic area, so it's not necessarily anything that he would feel. But again, he had symptoms of having to rush to get to the bathroom when he felt the urge. Otherwise, he'd have accident 2 or 3 times a day where he'd have to go home and change his clothes.
Oh, my.
Yeah.
And with that size of a prostate, how does that affect the size of the bladder? Or does the bladder stay the same?
No, what happens is when there's a bad blockage from the prostate, the bladder becomes what we call overactive, meaning that it starts to have spasms and gives that man the feeling of having to run to get to the bathroom when he feels the urge. So what happens is many times as the prostate grows and causes a blockage, the bladder actually shrinks and holds less urine as time goes on. That's one of the reasons these guys get up, 4, 5, 6 times a night to go to the bathroom, and they come in exhausted because they said, "I'm just not sleeping."
And of course, it disturbs their partner's sleep as well.
Absolutely.
Right? Getting up that many times.
Sure.
Without that continuity of sleep, at least I would think 4 to 5 hours, you have to wake up exhausted.
Yeah, and that's, again, a very common complaint that I see in men, that I just can't carry on my normal activities because I'm exhausted.
There's a website that'll be on our website at latenighthealth.com. I'm going to mention it right now, and that's fixincontinence.com, fixincontinence.com, that you can go to find out more information about treatments. What are some of the treatments for male incontinence? We talked about drugs. That's one.
Right. So there are drugs used in men to help open the prostate and to shrink the prostate. And there are also newer drugs, Mark, that are focused directly on the bladder to help relax the bladder and get rid of bladder spasms. And those drugs overall are quite effective, although they might have some side effects like making your blood pressure go up and making the person feel tired and those sorts of things.
So you're kind of damned if you do and damned if you don't.
Right, but I would say the drugs are at least 50% effective, and if the drugs don't work, then frequently we'll be talking about some kind of procedure on the prostate to open the prostate to help relieve the blockage and hopefully relieve that urgency in the bladder. Most of the time will settle down after the blockage is relieved, and the person can carry on a fairly normal life. So
you'd go in and do, would that be robotic surgery, the Da Vinci type of thing?
No, it's operation, people refer to it as the Roto-Rooter. So, yeah. So
you were waiting to do that to me, doctor.
Exactly. So basically we go through the urethra, go through the penis, and we have a special instrument that we use to trim away the part of the prostate that's blocking the channel. And that's a procedure that's been improved over many years and still very effective.
Is that a day procedure or?
Usually in the hospital overnight.
And a wheelchair out to your car. Yeah. Is it a painful procedure?
The person's asleep when we do it. So no, there's some irritation afterwards from just having the catheter or the tube there to drain the urine. But usually as time goes on, everything settles down, and most people are very happy with the result.
I know that I can remember I was a teenager and my grandfather had a heart attack brought on by diabetes. Uh-huh. And he had a catheter, and he was, we're talking, it's at least 20 years ago, much more than that. And he begged me to pull it out for him. Mm-hmm. Of course, I did not. I didn't want to touch it or go anywhere near that, but having a catheter itself for both men and women is not the most comfortable thing in the world.
No, Mark, and things have advanced a lot in that area as well. If somebody has a problem where they just can't urinate, rather than putting a tube in and leaving it there, we'll frequently teach the man how to do what we call self-catheterization, which means washing your hands with soap and water and putting a little tube in to drain the urine and then taking it out. The whole process takes like 5 minutes.
Oh, I see.
So they might do that 3 or 4 times a day.
And also, in my understanding is that urine itself is not dirty if you're healthy.
No, it's sterile, and doing the catheterization really, it sounds worse than it really is, but many times while we're waiting for the medications to work, instead of just keeping a tube in the bladder for somebody that can't urinate, they can do that self-catheterization and make the whole situation much more manageable. And
more comfortable, I would think.
Absolutely.
Let's take a look at male incontinence after prostate removal of the prostate. Mm-hmm. And is that a common occurrence? Is that a common side effect of having your prostate removed due to cancer?
It's not common, but it's thought that about 3 to 5% of men will have bladder control issues after their prostate is removed for cancer. And the good news is that if somebody has it, that is treatable. We can fix it. It's not something that you have to live with.
And on TV there are ads for women and incontinence, mm-hmm. and you see a woman rushing around looking for a restroom,
right.
a bathroom, and are women more prone to incontinence than men?
They are, but it's a different cause. In women, from having previous vaginal deliveries and so forth, they can have what we call stress incontinence, leakage when they cough or sneeze or laugh, just from weakness of the pelvic muscles. And they also can have that same urgency related to overactive bladder. So again, having that feeling, having to rush to get to the bathroom when they feel the urge.
What about stress? Does stress affect the bladder at all in both men and women?
It can, in that a lot of people say that when they're under stress, whether it's family issues, work issues, or whatever, that they have more bladder issues, more need to rush to get to the bathroom, more burning or pain when they urinate. So there are a lot of people that sort of internalize their stress to present as bladder symptoms. That happens all the time.
Earlier in the show, we had I was talking about the fact that you were going to be on the show, and that you can go to Costco or Rite Aid or Walmart or Walgreens, CVS. I'm trying to think of all the options here.
Uh-huh.
They literally have an incontinence aisle, and and it's got to be. I mean, from a psychological standpoint, I don't know what I would do if you told me after having an exam I need to wear Depends. I mean, that's got to be devastating to somebody.
Yeah, I mean, it's an issue, and it's thought that $30 billion a year are spent on pads for incontinence. $30 billion. So, I see a lot of older people that are on fixed income. They're spending $300 a month on pads because just to try to manage their incontinence. But, the good news and the take-home message, I think, to your listeners, whether male or female, Mark, is that it's treatable. It's not something that you have to live with. So if the person sees someone that's knowledgeable in the evaluation and treatment of incontinence, I would say almost always we can either eliminate it completely or improve it to the point where the person says, hey, it's manageable, I can live with this the way it is. It's much, much better than it used to be.
And how long have you been practicing urology?
35 years. I was 15 years as the chief of urology at Kaiser, and then 20 years here at Tower Urology.
And where our good friend Dr. Danoff is.
Exactly.
We're going to take a break in just a little bit, and when we do, I'd like to come back and talk to you about erectile dysfunction and how incontinence and ED can be related, or are they related? We'll find out when we come back. Our guest is Dr. Gary Leach. He is with Tower Urology in Los Angeles, in the Beverly Hills area. He's one of the leading urologists in the country, and we're very pleased to be able to talk to him today about male incontinence. By the way, again, you can go to fixincontinence.com, fixincontinence.com, and if you don't write that down, always go to latenighthealth.com. We'll have Dr. Leach's very pretty picture on our website, a copy of his bio and CV, his credentials, as well as a link to fixincontinence.com, fixincontinence.com. All right, I'm Mark Alyn. Daryl and I will be back with Dr. Leach. Don't go away. More coming up.
You're listening to Late Night Health with Mark Alyn. The show continues in a moment.